Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Globular global series or edition. This audio podcast is part of a Lunar Insurgence, and this audio podcast is part of a Skeletal Lobostics. This audio podcast is part of a Storm Lobostics production. In this audio podcast, a sort of an overview in looking at sort of transfusion alternatives in transfusion alternatives as part of etiologies linked to SCA and thalassemia. So different transfusion alternatives are known for the pre, intra, and post-operative period. Autologous blood donation and EPO-based pharmacological stimulating agents are efficacious in perioperative periods. Intraoperatively, acute normal volemic hemodilation, cell salvage, fibrinolytics, and specific anesthetic and surgical techniques, coagulation monitoring, and acceptance of minimal or low hemoglobin values, and artificial oxygen carriers can reduce a sort of allergenic transfusion. In the post-operative period, cell salvage, anti-fibrinolytics, and um, accepting sort of minimal HB values are again sort of alternatives have been evidenced as alternatives to transfusion. The use of EPO to increase erythropoiesis, so this the stimulation of red blood cells for example, through the kidneys into general physiology as part of hemostasis, offers some alternative to RBT, red blood cell transfusion, assuming normal and responsive progenitor cells and adequate iron, folate, and cobalamin stores. Prospective investigation should examine whether clinical outcomes from EPO use in SCA and thalassemia patients is effective, because platelets play an instrumental role in primary hemostasis, and platelet transfusions are often important in managing patients who are at risk of bleeding with thrombocytopenia or impaired platelet function. Platelet transfusions carry sort of the risks and decisions to transfuse platelets. Platelet transfusions carry risks, and decisions to transfuse platelets must consider clinical circumstances, because platelet transfusion in such settings may fuel thrombosis and worsen clinical signs and symptoms, and more issues for transfusion and more issues for transfusion, um, um, even when considering alternatives. That draws this audio podcast to a close. This audio podcast is part of a Globular Global. This audio podcast is part of a Lunar Insurgence. This audio podcast is part of a Skeletal Lobostics. This audio podcast is part of a Storm Lobostics production.